Team of scientists at Georgia's Institute of Technology has invented a low-cost, one-dose-a-month patch that could dramatically change birth control options for women around the world.
The new patch has actually not been tested on humans yet, but it has sparked immediate and enormous support for clinical trials. Alice Benjamin is a registered nurse and clinical nurse specialist, and she joins us now with her insight on this medical breakthrough. Thank you so much for being here. First of all, let's talk about the state of contraception and pregnancy in this country.
Well, what we do know is that there are over 85 million unintended pregnancies across the world today. And a lot of times the reason why there's unintended pregnancies is because there isn't a wide variety of contraceptives that are affordable and easily accessible to women.
So what's pushing that need for birth control and to be more convenient and accessible?
Well, in current state, because there are so many laws and legislations that are being proposed, make it difficult for women in their reproductive health state. So, but to prevent these unintended pregnancies, because we know that's a lot for not only the mother, for the child, and for society to help to raise these children, we really need to have systems and processes in place and products so these women don't have to go through these pregnancies when they're unintended. We really want to empower women to take care of their health, but the key is to have products that these women can actually use because, you know, we have several devices out there. There are condoms and diaphragms. That's a good physical barrier, but there's user error. We have pills, birth control pills, but sometimes it's difficult for someone to remember to take a pill every day. And then we also have like immunizations or IUDs. That requires someone to go to see their provider and have it given to them. Not everyone has the opportunity to do those things. So these researchers really wanted to design a device that many women across the world could afford and make it accessible.
Do you think it has to do with like the generation of kids today, or this new generation, not necessarily kids, but the next generation that will be using and needing birth control, that this is what they're looking for, kind of one-stop shopping once a month versus, like you said, every day where there's more error?
Well, everyone wants healthcare to be easy. You know, we want to be able to have our medication and our treatment and remove any difficulties when it comes to compliance. So not only do people want that, healthcare providers want that because we want you to get the treatment that you need. Now, I think it's very interesting, and I'm hopeful for this because it really takes a lot of the guesswork out of if someone's using their device properly, can they afford it? Is it, you know, because we don't want people to go without their medications, and so many times people do go without their medications, but to have this device that will be inexpensive, that can provide 1 month of treatment and apply it as quickly as in 5 seconds is something that we really as healthcare providers want for our patients.
5 seconds. So how does it work?
Okay, so it's a transdermal patch. We know patches, right? Nicotine patch, a pain patch like Solumpus in the store. Even our Band-Aids have Neosporin in them. You place the patch on and you apply a little bit of pressure for 5 seconds, add a little friction, and then these micro needles, which are dissolvable, just go into the skin, and then over the month's period of time, the medication is absorbed as the contraceptive, and the microneedles actually absorb into the body. And that's it.
And how effective is it compared to other forms? So
the medication that's in this, the levonorgestrel, is currently used in birth control today. So we know that it works. So this is just a new way to deliver the medication. And so patches aren't anything new. Microneedling, we're doing that with cosmetics. That's not anything new. So just marrying those technologies together will make it easier to deliver this medication and make it less hassle.
How soon might we see this on the market?
Well, because of the different components we all know work in different research studies, I think we just need to get to the point where we trial it in humans because we need to figure out what's the right amount of medication. That's really where these researchers need to figure out how much medication do we need to put in the patch. And then once we have that figured out, I think we can see it in the market as soon as maybe 2-3 years from now.
But the method of what I'll call transmission or whatever is effective.
It is effective. They studied this in the lab rats, and it was very effective. And like I said, the medication, the hormone that we're using now, we currently use that in our birth control medications. It's in our pills, it's in our IUDs. You know, so it's proven science. It's just this technology of trying to deliver it in a different fashion.
Very interesting.
Yeah.
All right. Alice Benjamin is an emergency room RN and clinical nurse specialist. You can follow her on social media, and there's her website, asknursealice.com. Thanks for coming in.
Thank you.